it is, record. Okay. All right. Okay.
You got it.
The recording is in progress. Jay.
Yes, the recording's in progress. Let's do this. Let me get out to my magical PowerPoint slide that everybody loves so much during Zoom talks. But we're gonna do a quick introductions, and then I'm gonna just really quickly, briefly talk about social determinants of healthcare in Hawaii, and then we'll have a panel discussion. These are some questions that we'll go back to. And honestly, I really want us to, as Rotarians to really think about what's going on in the world, not just in our backyard. And I really think Paul Morose has a really good project that we'd like to kind of close with, and hopefully get you sparked some interest in about helping people with healthcare issues across the world, literally halfway around the world. So without further ado, I literally just Googled, how do I do a Rotary Health presentation, right? And obviously I did it, but the quick question that was funny is always ask these old questions at the end, right? So surprisingly, we actually have the best healthcare in the United States. And does it feel like that? I don't know if it feels like that. I don't know. And I think the problem with it is disparities, right? So we have such a huge a bimodal distribution of wealth in our state, which also relates to, unfortunately, health problems. And just because our life expectancy in certain zip codes, for example, in Hawaii Kai, for example, there's a 10-year life expectancy difference between Hawaii Kai and Waimanalo. That's literally amazing. Just how many miles is that? Not that far, right? So just kind of keep that in mind when we're talking about this stuff. But why is healthcare so good here in Hawaii? So this article kind of popped up, and it's done by Pacific Business News. Could there be a little bit of a bias? Maybe. It is definitely a local newspaper, agency, but they kind of try to be objective about it. And they kind of just throw some things out there. We do have some problems that worsened us. We're still good, but we're not as good as we used to be. And some things they kind of threw out there that this study kind of found was that we still have increases in childhood obesity, bloodline, central line infections. I'm sure Brian is probably familiar, or probably doesn't want to be familiar with those in his line of work. He's an ICU nurse. And then ultimately preventable hospitalizations. And that's something that's Hawaii Pacific Health is really working on. And especially with COVID, we're trying to reduce the number of hospitalizations, right? Because we want to reduce that strain. But if you need to come in, you need to come in, right? So anyway, more or less the person who did the the person who did the study actually was quoted as saying some good things. But, another good thing is that we really have good, Quest and just our integrated Medicaid system is really good here. And in addition to that, employer health, even these small mom and pop shops actually offer healthcare to some of their employees. I'm not saying it's required, but it's just the fact that, we have this feeling of ohana. We feel like we need to take care of our own. And I think providing healthcare is something that our employers do really well at. So this kind of leads us to just kind of basic social determinants of health. I'm not trying to do a PhD dissertation to you guys here because I'm by no means trained in this. I know some of you in healthcare probably have been kind of, beaten on the head with this a little bit. But with that said, just some things, access to care, right? And access to housing. That's kind of a thing that's kind of creeping on our radar too. In addition to that, we also have things like, exposure to crime, violence, social disorder, presence of trash. We actually do really well at some of those things, honestly, despite us talking about we need to do more beach cleanups. We need to, we have this crime spree of these boys going around town, robbing, et cetera. It's really not as bad as some of the news you turn on in other parts of the states, right? So I guess those are kind of the things, but I think the biggest thing is this thing on top, access to good food, access to jobs, and I don't see it up there, but also access to housing. These are all strains that are hurting us. So with that said, I was trying to get this, honestly, I was trying to get this superimposed with the Rotary's, areas of focus, and it actually kind of intertwines with it. And sorry, I wasn't able to kind of superimpose a PDF. So in a second here, I'm going to zoom out of this and then not zoom out, but get out of the PowerPoint and put it into the PDF here in a second. But just kind of look at some of these things: economic stability, environment, education, right? Food. These are all things that we're talking about in these breakout sessions, right? And they all kind of tie into healthcare. So regardless of, obviously I'm biased because I'm a physician myself, but everything that Rotary is doing, whether it's peace, whether it's the environment, whether it's water, sanitation, hygiene, they all kind of interplay into health. And the definition of health obviously is overall well-being, right? So it doesn't necessarily have to mean you're physically well-being, and that's why it's really key that some of our panelists tonight or today this morning are actually advocates for mental health. And I definitely wanted to make sure we had a very good balance of that. And we also have Bridget, I believe, is on as well, and she's actually in terms of her practice, definitely bridging the gap between the holistic and the physical and the mental health, emotional well-being. So with that said, just going back to the introductions, I don't have our, let me just get out of this sheet because I could actually read it without you guys reading it with me. But more or less, we have some, really key all-stars here. And I kind of feel bad because I keep asking these same champions to come and help me with these talks, and they come back, and because they're amazing, they're professionals at what they do. But to start off, we have Lynn Goya. She's a president-elect of the Rotary Club Mililani Sunrise. She's a child and adult psychologist. She focuses on therapy. She actually has a pretty long career, not only practicing in town, but now up at Mililani. Kathleen Merriam, she's a past president. She's now with the Rotary Club, the E Club, and she's a licensed clinical social worker. She also, she's actually right now, she's actually I believe the co-chair of the American Foundation for Suicide Prevention, the chapter here in Hawaii. She's also really big in NAMI and the NASW, which is social work and mental health organizations. But primarily her profession lately has been working with the Department of Health and being a huge advocate for mental health all across our state. So really lucky to have her here. I mentioned Bridget Bongard. I think she's here.
I'm here.
Oh, there she is. Hi, Bridget. Sorry. As an internist, she definitely is formally trained, but she also has, integrative medicine training, and in addition to that, I think that's brought a real big holistic approach to kind of how she approaches healthcare. And I definitely would highly recommend, if you can, get her to present at your club, because she actually has a lot of good things to say about how her approach is. And as a physician myself, being Western trained, and I guess formal, I don't know what term would be called, traditionally trained or formally trained, I guess. She definitely has a really good approach, and that's kind of all culminated into her co-founding and directing the Maui Cancer, resource, which is a really good retreat area in Maui. And again, as a physician, I've actually sent some patients that I've met who unfortunately been diagnosed with cancer to her. Hopefully, they did go through it, but I definitely have a lot of positive things to say about Bridget. And in addition, thank you, Bridget. And I believe Al is here as well. And I think out of all of us, I think Al has probably the most experience in healthcare. He's actually who's trained at Northwestern University, and also is a OBGYN who had, it said about 50 years of practice. Al, is that right? 50 years of practice in OBGYN? That's amazing. But,
no.
Okay.
Not
okay.
Thank you. It was about 35.
Sorry about that, Al. maybe when I saw added on the current years, and they're thinking that you're currently practicing. But anyway, with that said,
but I probably can't remember anymore. So.
But Al is the president of the Rotary Club of Kihei Wailea, and another awesome resource on Maui. And we're excited to have him. And he's provided so much expertise on some of our panels as well in the past. So anyway. With that said, without further ado, I just Paul Murrows. I forgot about Paul. Paul is a orthopedic spine surgeon at Shriners, and he's actually probably done literally probably boots on the ground in the field work more than anyone I've ever met. So he has a wealth of knowledge, not only in his current practice but also internationally, and we're excited to see what he has to say in terms of his project he's working on. To go to Poland himself. So with that said, let's start off with some, actually, you know what? I'm going to be a little bit non-traditional in this, probably for the sake of time, but any questions from specifically around in relation to kind of, because I guess the focus of this is how, as Rotarians and Rotarians in health, how can we advocate for projects that can actually help our communities here locally first, but also that can help our communities kind of across the world, and so, I know that some of your, not necessarily the panelists, but just outside the panelists, any projects that your clubs have been doing or have done in the past, with or without COVID, just feel free to kind of just chime some things in. And, I kind of like to go around and kind of see, give you guys a little bit of the floor, and then maybe we could then, come up with some questions and get some of our expert panel to kind of, give some guidance on, or if you have any questions on the project idea or anything like that. So feel free to.
I'll just say one thing that I think is remarkable about Rotary in general, because I'm a relatively new Rotarian. And first of all, James, I thought your intro was awesome. I think now you deserve a PhD, and from now on, I'm going to call you doctor. Okay, so anyway, but I'm an academic guy. I'm at JAPSOM and the prof thing and the whole bit, and I've had done the grant thing and all that. But what I've been so impressed about Rotary Club in general is how fast they are able to respond to needs. You try to do that in academia, you got to put in a grant, you got to apply for the grant, hours and hours of study, and then wait for a year, and then wait for study, and then and peer review clearly is extremely important. But when there are emergent things happening in real time, I am so impressed with how Rotary Club has responded. Win Shoneman, for example, he's in our club, and when the Ukraine thing started, he just jumped on it because he had Rotarian connections in Romania, and he's all over it now. It's unbelievable how he's getting things done. And just the way people respond to COVID and stuff. That's the cool thing about, you asked about Rotary involvement in health issues, and I'm just so amazed at how Rotarians can, and it's all about networking, and that's a huge thing. So that's all I wanted to contribute and right now.
Yeah, and I guess my one of my points, I guess, is that maybe just how my brain thinks, but you could really connect any project you do, to health, and I think Rotary is such a I've always had this question with Rotarians I've met at conferences or whatnot that are physicians, and I've always wondered why more healthcare people aren't in Rotary, because Rotary in itself is such an advocate for health, and I guarantee you, I wish I could get in on some of these other breakout sessions, because I guarantee you there's some element of that, whether it's, peace and conflict, all the conflict that's going around that we just heard about, how that affects our health. But, I kind of wanted to kind of, just touch base with that said, about mental health and, some of the health issues we're seeing. And I know that, obviously, it's a no-brainer that COVID actually has unfortunately made things worse for us. But let's talk about the positive things. What are some things that maybe your clubs have done that, or maybe you in your own personal circles even have done to kind of, make things a little bit better, just in general? Like, what are some maybe small things? I don't want to call them projects that make me sound too formal, but what are some things that maybe Reggie, go ahead, please.
Yeah, so I'm doing Nan duty here, watching my grandson. That's why I'm going around like a little whirling dervish. You can hear him in the background. He's really cute. But what I wanted to say was, I think what you hit was a very key point, was advocacy. We need to teach people how to advocate for themselves and find the resources. So what Maui Cancer Resources has done is created a patient guide through your cancer journey, which is a personalized document. And we actually work with the Hawaiian Cancer Coalition and the Department of Health in Oahu to formulate this and do a beta site on Maui. So a cancer patient now, I'm sorry, okay, here you go. There you go. It's a good one. It's a goodie there. And so we're developing this booklet. It'll be electronic when we get done, but there'll also be hard copies for those who are caught in that informational gap between computer illiteracy and computer literacy, right? So what we're doing is we're having people assemble what is our support team, who is your support team, not only professionally, but non-professionally, all the way to respite, who's going to help you clean your house, who's going to take you to and from chemo, et cetera, et cetera. And then the second section is on diagnosis and treatment, what questions to ask. And I think for all Rotarians, that's something that we need to teach people to think, what questions do I really need to ask? So I'll know what information I need to get and how to get that clarified. And then there is post-treatment, how can I maximize my health? And then there's a resource page, and it's got, when do I call my doctor? If I have a fever of what? If I have bleeding where, or if I have how many loose bowels. So in other words, it's really helping people to access care properly, not to show up in the ER. Okay. And which then clogs the system and then causes a lot of problems, because then it takes a while for that information to get back to the primary care doctor, et cetera. So what we're trying to do is close the loop. So we actually interviewed cancer patients and did a qualitative research piece to find out where the PUCAs are, and then directed this book towards that so that they would have resources. And this will go to the practitioners initially on Maui and then, everywhere, and our nurse advocates who can then work with people. So I'm hope this is what Dr. Weiland is also kind of working on. We're both working on a comprehensive cancer center for Maui, so we can start really closing those PUCAs. And I really give Al a huge thumbs up for his involvement. And so and I'm past president of our Rotary. So this is how Rotarians can really work. So any of the Rotary clubs that want to throw their shoulder behind this and make this happen, that's a big, big thing that we can close, a big gap that we can close.
Was this a Rotary initiative, this project?
No, well, our Rotary Club has supported Maui Cancer Resources. But we're a teeny club. And so I reached out and, Al has joined sort of the initiative, and we have other people that are working on this, and cancer patients are actually inputting what was important to them along their cancer journey, and where were the PUCAs, and how do we close them, and what informational gaps are there, and how do we fix that?
Great project. What a scary time when you hear the C word.
Yeah.
Well, we talk about emotional trauma. I mean, this is complex trauma. And I'm sure that Kathleen and some others, Lynn, we all understand, and James, and everybody, Al understands complex trauma, where one trauma just builds on the other, and the past sort of bleeds into the present, and, makes people stop. They don't know what to do. So these are the ways that we're actually giving them the ropes, the life preserver, and to help themselves, because James said advocacy is just critical, but we have to teach them how to self-advocate.
Yep. Terrific. That's great.
Oh,
I
thanks, Lynn.
think Kathleen had her hand up. Kathleen, go ahead.
Well, I just wanted to jump on the topic of Rotary helping us mobilize, because there's no other organization that really can help us mobilize quickly and effectively. That's how I heard about my first international project, going to Myanmar and Taiwan, about setting up medical clinics and traveling with all these doctors. It was just because a Rotary Friendship Exchange. We just hosted some people from Taiwan, and boom, we heard about the need and we got to go. But mobilizing through Rotary, I want to tell you about a group that I met with this morning at 3 a.m. So there is a mental health Rotary action group. Now, the bummer is we have to get up at 3 a.m. because it's 9 a.m. Eastern Standard Time. But there were people from all over the world, and they were talking about some of the global grants that were used. They are doing some great work with children that are affected by all the refugees that are moving to different countries from Ukraine. So there's a report on global grants. They're asking different countries what they're doing for mental health. Next month is May Mental Health Month. We could right now mobilize with our clubs and social media, hashtag mental health matters. All of us could agree to do something to touch mental health moments. We could talk about mental health in our clubs. We could reach out to organizations that address mental health and health in general. But I think we have a real opportunity to move and mobilize like no other organization, especially with our partnerships. So I just want to, promote that idea that the time is now.
Well, Kathleen, can I say one thing? When I was involved in a grant many years ago in Canada, a big grant, lots of money, I tried so desperately to get into Myanmar and went in the usual channels, and I had so much trouble. Yeah. In fact, it never happened. It never happened because of political stuff. And look, and you went the grassroots, which is the way to go. And I've been trying to get into Myanmar for 25 years. Congratulations.
Thank you. It was amazing.
And Lynn, go ahead, please.
No, go ahead first.
No. I was actually gonna go look around, see if others had anything to say.
Oh, okay.
Perfect timing.
Okay, so I just wanted to try to focus more on the positive side of what we can do to help mental health, because all the psychologists I know are book solid. I have a waiting list, and I can hardly move people off the waiting list because there are so many people calling. Yeah. And so we as psychologists can only do so much. But as Rotary, we can reach groups of people. So my idea is that mental health, I think, is not just emotions, but it's also the spiritual side, which is like soul. And with the soul aspect, I think of things like laughter and awe, like looking at nature. Yeah. So I have some suggestions for projects. Going to a nursing home like Maluhia, which is a very, very old nursing home with not many people visit there, and having karaoke. Singing is so good for the soul. And research has shown that singing, even people with Alzheimer's can sing and remember lyrics from when they were young, even if they don't remember their family members. Yeah. And it's great for the soul. Having a costume contest, bringing like those wraparound fluffy things or whatever, just doing something fun. There's a therapy dog group that I know of called Canine Therapests, and they have therapy dogs that they can take into places like nursing homes and schools. I think that would be a great way to lift spirits of seniors in nursing homes. An intergenerational event. When we talk about the depression and anxiety in youth, what if we had them working with seniors and helping each other? Yeah. And it could be things like playing Scrabble with them, having a karaoke thing where they sing along together, or taking them, having the high schoolers help a club take seniors from a nursing home, like let's say the Plaza, out to a beach like Kualoa Park, where you park in the parking lot and the grass is just feet away from the parking lot, so they don't have to walk very far. You set up a table, you bring chairs, and you feed them bentos, and they can look at the beach. And how being in a nursing home to me is like the COVID lockdown, but they are there for years and years. When do they get to go out? And more, I'm thinking about places like Maluhia, where I'm not sure if they have regular outings like the rich people in the Plaza, right? I think in the schools there, we do a lot of things for scholarships. We do a lot of things to recognize the students who are successful, but we don't do a lot of things to recognize the students who are having problems. Yeah. And I remember when my kids were in elementary school, I would see this boy sitting outside of the classroom almost every time I went. He probably had ADHD, which was undiagnosed, but he looked so sad and so lost. And he felt like he was hopeless. And I thought, if there was one adult who could help him feel like he was important, that adult would make a difference in his life. Mm-hmm. So what if we had projects like the Forgotten Student? And we wouldn't necessarily label the award that, but we asked teachers, who in your classroom do you think needs help with self-esteem, socialization, confidence. And then you get this group together from a school and you have something fun, really fun, like, go to a park and play baseball, but just have fun with them so that they feel valued and recognized. And, that, hey, somebody noticed me. Yeah. Because I think Rotary is great at recognizing the successful students, but it's the forgotten ones that are having mental health problems a lot. Yeah. Okay.
I agree totally, Lynn. I think that's absolutely brilliant because if we can give them that self-esteem, then we're actually giving them a skill set that they can use throughout life.
Yes.
And also find out who they are.
Mhm.
Everybody's got a gift. Everyone's got a talent. And how
Uh-huh.
do we connect them with that? And that's going to see them through because they'll go, oh, but I'm good at this,
Yeah,
and I
exactly.
love that idea. I'm going to unmute. I'm going to mute here.
I just want to just kind of dovetail on some of these topics. One thing that one specific project I think we're going to be advocating for. Please visit us at the House of Friendship. By the way, it's going to be we're setting a booth for the Coalition for a Drug-Free Hawaii. I'll also be on another booth for the International Service booth, so I'm going to be boothed out. But with that said, there's actually, I believe, 4 Rotarians from the Rotary Club of Waikiki actually that are on the board with me at the Coalition for Drug-Free Hawaii. And there's actually a new a group called the Rotary Action Group for Addiction Prevention. And it's definitely something you mentioned, Lynn. You nailed on the head. But I was thinking something more specific in terms of actually finding the kids that are at risk for drug abuse, things like that. So it's in the works. Just kind of let everyone know here. I'm not trying to promote my own projects, but it's because it's not going to be mine. I'm actually looking for someone who might be interested, a club who might be interested in maybe taking ownership of it. But something that the Coalition for Drug-Free Hawaii is working on. Another organization, I guess, more grassroots, but also hands-on, and people who like to build stuff. The Men's Shed is a group that we've supported, and it's a group of elderly men and women who actually work together to actually prevent some delayed onset Alzheimer's, to improve their skills, to socialize, to get out of the nursing home or get out of the house, and they kind of build things with their hands. And some of these guys do some amazing work. And one merge that we're doing with that project, with that group, is with the Hawaii Home Project, which is kind of near and dear to me. And in addition to that, the trying to get some of these elderly men and women to actually help with a project to help us build a van. So we actually were able to get a brand new van donated to the medical school to set up a new mobile clinic. And so we're going to be utilizing some of these men, gentlemen, and women to actually help build this van up and kind of make it one of those like camper vans, but for medical clinic, right? So some hands-on, and just because people aren't healthcare oriented or aren't able to kind of counsel or work directly with kids or elderly, they could still kind of help in their own way. So just kind of keep your ears out, because some of these things are going to be happening hopefully during the summer starting up. But yeah, I just want to throw some ideas out there for people, and obviously internationally, we do a lot of healthcare internationally, and I think it's just because honestly that dollar goes a lot further, in a developing country than it does here in the States, and they just don't have those programs there. And we're fortunate here in Hawaii that we actually have standard healthcare, and I call it standard because there's a lot of things that we still lack, but the basic kind of stuff we still have access to. But with that said, I mean, if there's any other questions or anything like that, I just want to kind of give the floor to kind of Paul and kind of let him talk about a project that's definitely direct, and we could help in different ways. I think I see a hand up. Kimo, go ahead.
I think the discussion about mental health is just absolutely a critical one that we should, our clubs should consider focusing locally. It's such a huge problem. But I just wanted to give a plug. You mentioned the House of Friendship, and Kathleen's here. Thank you. We're going to be with you at the House of Friendship, my global telemedicine group. We're going to have a booth there, and we're a nonprofit that works exclusively with Rotary clubs around the world. Dr. James and Paul know about us, and that we've developed projects in, of course, Nepal And currently we're building out in Beirut, Lebanon, fascinating project there. And we're also in Africa. We've got several projects that we're developing in Rwanda, Tanzania, Uganda. And I'm also very, very proud of a project currently going on in the Philippines. So we're going to have our medical doctor advisor coming over from California, hopefully going to be with us at the House of Friendship. So please stop by, have a little dialogue with us. We would really love to kind of develop something locally here in Hawaii with one of the clubs and just, you know, build on the whole. This last year has just been an enormous expansion due to the pandemic for our global telemedicine group. It's a 501c3, just with the basis of working with Rotary clubs and Rotarians around the world. So I appreciate the opportunity to have a little plug, and we'll be with you at the House of Friendship. Thanks, Kathleen, for plugging us in, and James and Paul, thank you again for your support.
Hi, James.
Paul, go ahead.
We could do a share screen. I was going to show some slides.
Yeah, shucks. You know what? Let me get out of here. I tried to. Oh, shucks. Let me get out.
And so, yeah, I wanted to put a plug in for.
Oh, shucks. It's not letting me share your screen. What is going on here? Oh, there you go, Paul. Cool.
Where are we here?
I think you got to exit out of this and then go and then find your PowerPoint.
You see that?
Yeah, see it. Perfect.
Okay. I'm not gonna go through all of these, but some of them because we're short on time and I talk fast. So hold on here. Let me
go to left. Perfect.
Yeah. Okay. So Hope for Ukraine, Hawaiian Orthopedic Project for External Fixators. And I'll tell you what external fixators are in a second. I had some disclosures here. I won't go over this. You guys will all see the news. It's hard to believe what's really going on in 2022 and the carnage that's happening in Ukraine. This building, you know, when disasters happen, like earthquakes and certainly conflict, you can imagine the orthopedic carnage that happens. People falling out of buildings, people being crushed by buildings, people being hit by bullets and shrapnel and run over by tanks and things like that. There's a lot of orthopedic stuff. And for every death you hear, there are probably, this is the injury triangle. For every death you hear, there's probably five major severe injuries, like an amputation, like a spinal cord injury, like a disabling broken open fracture. And then there's more of the small, minor injuries, and then there's the more other injuries, and you could put mental health in there as well. Will be a big factor. So again, this poor woman. I didn't cover her face because this has been around the news around the world from the very beginning. She ended up passing away. This is a bombed maternity hospital. She had a crushed pelvis and a dislocated hip. And so I've been in touch. This is a poor girl who died in Mariupol as well and so it goes on. And then there's the war crimes, which I'm not going to get into, but and then there's the torture and all sorts of things. So this is an amazing picture from yesterday. This is a missile, missile at the train station that says, "For the kids." This is the Russians writing, "This is for your kids, this missile." It's unbelievable. Anyway, so how do we respond? Response and tips. I'm a Canadian, so I watch the Canadian news and stuff like that. But this can be for Americans, South Americans, everybody. So the ICRC is responding. UNICEF's clearly responding. Ukrainian associations around the world are responding. And Ukrainian Medical Association is, because of the highly contaminated wounds that happen, the explosive munitions and bombs and artillery, the rifles, then it's a lot of orthopedic issues. This is from a group of orthopedic surgeons in America that are publishing this kind of thing to send around about external fixators. And then, of course, the Rotary Club, the International Rotary Fellowship of Healthcare Professionals, from the very get-go, and underlines the response to the Rotary, is started right from the get-go. And John Phillip in the UK has done amazing things to get the Rotary community talking and getting ways of getting. So I'm getting equipment, but someone else is doing the logistics to get stuff to Ukraine. Someone else is getting us stuff into the hospitals there, and it's just an amazing response. The Ministry of Health of Ukraine has sent around lists of what they need. They kind of need everything. And then I put this out because all this lists, I'll see external fixation. How many do they want? 5,000. Well, multiply that by 20 because the external fixators come in different sizes because every bone is getting injured. And so what's the big deal about the external fixators? And I'm sorry about the picture, but when you get an open wound like this, the problem with bombs and gunshot wounds and crush injuries are infection, and fractures are not going to heal if infection is present. So this is what happens when you've got an open wound and a broken bone. You need to stabilize it with basically 4 long screws into your bones on either side of the fracture and a couple of rods to hold it together. It sounds barbaric, but it works amazingly, and it can be rapidly deployed. And that's what you need to do for what's called damage control orthopedics. So that this guy, this leg, who also has a head injury, who also has a chest injury, who also has an abdominal injury that needs surgery, can now be safely transported without a broken leg that's bleeding all over the place. And so the orthopedic surgeon, here's a guy hit by a sniper. And so there you can see the bars. He actually didn't get fixed for about a week because the Russians wouldn't let him out. And he's got this big drain here. And you may be hearing about, this is a little bit more about the external fixators. Here's another girl with another external fixator. You might hear a lot about vac dressings because with these open wounds, and they can be open wounds anywhere, abdomen, leg, arm, head, back, and because you can't close these wounds, they'll get infected. So you need something to, so this goes on top with like a cellophane tape and then a suction tube, and it sucks out the infection and cleans it up so that it can then be skin grafted or closed. Extremely important. So hope is I put out an email to the whole orthopedic community in Hawaii, and they responded. Here's a truckload arriving to the Shriners Hospital where I work from a friend over at the Kaiser Hospital, Kaneokike, and he goes to Ghana every year to teach orthopedics and to do orthopedics, but he hasn't gone for a couple of years because of COVID. He said, Paul, take all this stuff. And it was an amazing contribution. Other people who didn't want to be identified have been contributing. And so we've got stacks and stacks of external fixators and equipment. This is a prepackaged external fixator in a blister box that, rips open and is immediately deployable, and you can stabilize a fracture in literally minutes. And this is what they really, really want. But here's other plates and screws that they'll be using for other fractures that they need to fix, which they don't have and desperately need. And so we're getting stacks of these really, this is great equipment. And this is a military grade external fixation kit, which we got, I can't tell you where this came from, and so we're boxing it at Shriners, and we're listing it, and we're getting it ready for shipping. I've been in contact personally with orthopedic surgeons at Kharkiv in the Far East. And this is Konstantin Kostyoromenko. We've been in touch. Is he still getting, because he's up in here right near the Russian border. And I can't believe that they're still open and getting supplies. And so we're sending them other things. Of course, you need more than just external fixers. He needs high, power drills. They still get power. And so battery operated drills to put these screws in. So we've got those to send him. And then his friend, Stanislav Bodnarenko, he's a spine guy. So when these buildings fall and people get, as in this right X-ray here, fracture dislocations of the spine, and says, we currently don't have any implants for spinal surgery. We need blah, 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 all this kind of stuff. And then he showed me some x-rays of some stuff he's doing, like that fracture. This is what he needed to stabilize that fracture and to prevent paraplegia and pain and death. And then these compression fractures here. And so this is basic stuff that everywhere in the modern world has. And this is not fancy stuff, but this is essential stuff that we've collected. And I'm really pleased to help these two guys. I'm in touch with them almost on a daily basis by WhatsApp or by telephone. And so I'm really happy for Mark Merriam to get on board and help us out through James and through Wynn. And so we've developed the Hope for Ukraine Fund, and Mark has helped me develop. The other thing is, I'm surprised that Ukraine is the poorest country in Europe, and I won't get into that. But so this is this is where Mark helped me too. There's 3 ways to make donations. You can make it through, you can mail a check to Mark and you'll get a tax receipt. You can hit this link and you can get a PayPal or credit card or debit card, or you can hit this QBot and it'll pay right on your phone in a few minutes. You can email me with questions and stuff like that. And thanks for letting me put this plug in. This is not going to be an ongoing huge project for me. We're going to get this equipment out to them because they need it now. And so this project will be relatively short-lived, but we'll roll into other projects that are happening around the world. And thanks for helping. And I'm happy to give a talk to any Rotary Club. Just email me and I could give this presentation anytime. Sorry for talking so long, James.
No worries, Paul. That was amazing. It looks like we're gonna have to leave. Perfect timing. We're gonna have to leave, but please direct your questions. Feel free to contact me if you need any connections with any of the panelists or anything like that here.
Great session.
Well, I guess we got 48 seconds. Never mind. I thought it popped up saying we're ending right now. But anyway, 44 seconds to sing a song. Anybody? But yeah, thank you again to the panelists. Al, I think do you want to say something, Al?
yeah, I'm not going to sing because that will close the room. But one thing about doing healthcare projects in the community is that we're not alone, and there are tons of other organizations that want to partner with us. And as we partner with them, we learn more about what their needs are and more specific and better ways to meet those needs. And that we had a Keiki Health Fair, and 14 community organizations said we want to be there. They all